I'm Dr. Phil Schauer, Director of the Minimally Invasive Surgery Symposium, otherwise known as MISS. Today we are celebrating our 15th anniversary, and I'm fortunate to have two of the co-directors of MISS here with me today, Professor John Dixon from Australia and Professor Bruce Wolfe from Portland, Oregon. And we're here to sort of discuss some of the aspects of MISS that have attracted an audience now for 15 years. And gentlemen, perhaps I could start with you, John. Both of you have done a marvelous job over the years in really putting together the ingredients of the bariatric portion of MISS. And we seem to have quite a bit of luck in attracting some outstanding speakers. So can you tell us just about how you go about identifying speakers to invite to MISS?
Well, Phil, the meeting has to be alive, it has to be fresh each year. We have to look at the topics that we want to cover, and we do this very early on after, this meeting we'll be looking at next year's already. And then we've got to say, well, these are the key things that people need to learn, they need an update on, and we find the best speakers. The key thing is we need people who know the facts, but they can also present them beautifully, and they can present them in an elegant way to surgeons, because it's largely a surgical audience, and of course allied health. So it's a task. Fortunately, we're able to find, and we go to a lot of meetings. Surgeons don't. They don't have the opportunities we have to seek out these people, but it works.
Indeed, and Bruce, in addition to top speakers, it's also a matter of identifying the key topics, as John pointed out. We seem to have a nice array of basic science orientated as well as more practical clinical. So how do you go about that fine mix of topics?
The key is to have a finger on the pulse of what the emerging clinical issues are, how they affect patient selection, choice of procedures, performance of procedures. And it's an evolving field, so we want to stay ahead of those evolutions by talking about basic science. We're giving a preview of what's to come and what the issues may be that will enhance the decision making in clinical care. At the same time, update as to what do we know now that they can apply to clinical practice. So if we combine those both, hopefully we can anticipate what will be the best topics to focus on each year.
Excellent. Well, can either of you give us some examples of topics or speakers in this year's program that were particularly interesting or appropriate for this audience?
Well, I think Alison Goldfein has just been superb with her discussion on how bariatric surgery improves type 2 diabetes, and she followed that up with an excellent overview of hypoglycemia in gastric bypass. State-of-the-art topics, never really been presented in such a detailed way before. This is what we get at this meeting.
Can you imagine a Harvard professor coming here to talk to surgeons about mechanisms of bariatric surgery and diabetes remission? That's pretty cool.
Excellent.
And weren't there some other...
We know Dr. Goldfein from our personal interactions at meetings, and she is truly devoted and interested as well as expert, and we've heard her speak. So yeah. All of those criteria are met.
Absolutely. And we heard some other provocative talks. John Morton, who's currently the president of MBBS, spoke about the role of the gut microbiome, which appears to be quite a hot topic these days.
That's an example of a hot topic that we don't have the clinical answers. We don't know exactly how to apply what's being learned to bariatric surgery, but it's worth informing our audience as to what's going on in this important area of research.
Yeah, I think it's very important because it's such a relevant area in all gastrointestinal physiology, and we really need to drill down. And it's not good to have a whole area like bariatric surgeons not really understanding this is an expanding area in gastrointestinal physiology. It's exciting.
Excellent. Also, we've had comments in the past about the audience themselves participating and actually contributing with frequent interactivity through the Q&A sessions. Could either of you comment on how the audience actually contributes to the program?
They certainly help all of us know what the questions that they have are and can be addressed. We may not always catch it as to what the key questions are in the minds of the audience, or what questions we've raised or not made clear in the presentation. So all of those aspects go into what the questions are, and we can usually pick those questions up and run with them to enhance the session.
Yeah, go ahead.
Of course, we have adequate question time, but also we have interaction between panelists and then with the audience. So we have debates, we have panel discussions, hot topics are discussed, and many of the people come back year after year, and the reason for that is they like that interaction. They really like to hear the experts interact, and they interact with the experts, and this meeting's been able to drive that for many years now.
And I've also seen time to time, and it happened this morning, where one of the speakers actually did an informal poll of the audience on what she thought was a relatively rare complication, and it seemed to be more common or commonly experienced by the surgeon. So that seems to be another area where getting the audience engaged can help us learn more about what's actually happening out there in the real world.
And that is important, because as researchers we know that having precise data on how infrequent complications occur is elusive. So the publications don't really answer the question as well as a show of hands at a meeting like this.
Very good. Well, I know as we begin to wrap up this 2015 meeting here in Las Vegas, I know both of you have already started to think about topics and speakers for next year, and I can't wait to see some of the ideas. Don't tell us now, don't spoil anything, but I can't wait to see what great program you have in store for us for next year. Again, thanks so much for being involved with this, and look forward to a successful 2016.